What's up, Go to ones? Frank from the Go to Guild here, your favorite product marketer. Checking out Ciba Health. They just raised $10 million. Props to y'all. I'm gonna check this out. Uh, I don't have any. I didn't read any descriptions, so this is my first time really going through the site. Headline: Where transformation begins. Scheduled demo. There's a woman at the beach. I don't know what that has to do with health, but okay. Um, Kind of just like a random stock photo. Somebody's happy. I guess they use Ciba Health and they're healthy now. Um, I don't know.
I want to ask you a bunch of questions, and I want to have them answered immediately.
This doesn't like frame what they do or give me anything. I feel like this kind of is not that useful. So in terms of the hero, just like if I land on this, would I bounce from this? I probably would bounce from this because I don't actually know anything about what Ciba Health is about. Um, so I don't even know. What can I give this? Just because it has health in the name, it gives me some context, but honestly, I gotta give it like a 3.5. I don't know. I don't know what to say. There's nothing there. I would have at least a tagline or something um, about what they do. Transformation begins. I mean, it could be a million different things. So for the rest of the page, um, I mean, I need to understand. I'm assuming it's like a healthcare organization. I don't. I want to know if it's like an app-based thing, virtual, what the methodology is. Do you take insurance? It's the most important question. Those kind of things. So partners, Instacart. Um, for like food delivery. It's like okay, plug and play accelerator, Microsoft. Cool. That doesn't really tell me much because I don't know what the nature of these partnerships are. The leader in personalized whole person care to prevent and reverse chronic disease. That should be here. Because that kind of gives me an idea. Whole person care to prevent and reverse chronic disease. Um, let's just read this. Ciba Health treats whole person by focusing on the root cause of chronic disease. Our approach makes it possible to prevent and reverse one or more multiple chronic conditions. The impact of root cause medicine extends beyond individual patients. Blah blah blah. That's cool. That is something different. I feel like a lot of medicine is kind of just reactive, and people wait till they have negative symptoms to make changes. So, um, and there is kind of a division between mental health and physical health in certain contexts. So if they could find a way to put it all together and coordinate, because they all kind of play off of each other, that would be interesting. Um, cool. The symptoms and the root causes. Cool. SIBA methodology brings together cardiometabolic health, autoimmune, gut health, mental health. Cool. So, like I was saying, kind of bringing these different disparate things together. I think that's pretty cool. High touch approach. Okay. So I'm kind of seeing it. I mean, I'm assuming this is me in the middle.
Bruh.
Just imagine that as me in the middle, and I'm getting all of these great folks. Kind of healthy food delivery. Okay. I guess. I mean, I guess. I mean, yeah. I mean, the food we eat is an important, super important component. Um, do you really get any benefits of having the food delivery being part of this? Maybe. Maybe I haven't thought that through yet, but kind of seemed like overkill. But we utilize cutting edge technology, connected devices, and remote patient monitoring to equip patients with the knowledge they need to achieve their health goals. Complete blood count. Your new labs are available based on your lab work. Please take one tablet per day in the morning before breakfast. Okay. Following appointments. Follow appointments here. It's a little hard to read some of it. But cool. Seems like they have an app that helps deliver care updates in between. So I was finding with my mom's stuff when she was going through cancer treatment that a lot of times the discussion we'd have, you know, a meeting scheduled, and we'd wait a week and we have this meeting that could have been, 2 or 3 updates. Meeting lasted 5 minutes, and it was all this effort for not a lot of communication. So if this could reduce the amount of meetings that these doctors need to have and get a little bit more ongoing work, I think that would make a lot of sense. 80% NPS or 80%? Is that how you do NPS? Chronic disease reversal 98%. Interesting. I mean, these are all percentages. These don't really. It kind of doesn't give you an idea of what the scale or what that really means in practice. It's probably better to have a.
My health coach is excellent. We
Testimonial.
really have gotten along very well and are working very well together. I really appreciate the fact that she's very supportive. If she doesn't know the answer to something, she always goes and finds the answer, and she gets back to me in more than a reasonable period of time. So she's just a delight to work with. And you kind of have a certain connection with people. Some you do and some you don't. Well, I think we have.
That's okay. Not the greatest.
My A1C last check was 5.3, I believe. So that's really good. Being diabetic and having a 5.3 is awesome. A non-diabetic level. So it's the lowest it's been in 3 years. So yeah, I'm happy with what's going on.
These aren't like hitting like it should. Like, these are people getting good results, but I mean, essentially what you want people to be saying, and hope maybe that stuff needs to change in the product, but I'm assuming the product works well, is that this approach was different than the approach of my like normal hospital that I would go to, or my primary care. Exactly. And additionally, in contrast to our regular primary care physician's approach, we're no longer merely addressing symptoms as they emerge, but intentionally working towards optimal health. I mean, some people would argue primary care physician should be approaching things more preventative ways, but in my experiences, they don't. Most of the folks I talk to, they kind of just react. I would probably put images on the rest of these pages, rest of these testimonials. And the videos are a good idea. I just think there's probably better quotes. We have an FAQ on the homepage.
That one there was a violation.
A violation.
No! God, please, no! No! No!
The 3 differentiators is something that should be on this page. Like, it probably should be like around here, right? That would help at least kind of solidify the page a little bit. It feels like FAQs feel like an afterthought. It's like, all right, we made the page, but we don't have everything answered. So I would definitely add some more to that. In terms of the page, I don't fully understand how much of this is virtual and how much of this is in person. I'm assuming most of this is virtual, or all of it, except for the labs, because I know there's a labs component. I assume they're not mailing you labs, but I mean, they could do that. There are orgs that do that as well. I literally don't know how it works. High touch approach. Tech delivery. We use color device and remote patient monitoring to equip patient with knowledge they need to achieve their health goals. So maybe it is all virtual. I mean, they raise tech money, so I'm assuming. Yeah, like Rad AI or others, I think they had that the insurance coverage is like one of the first things you see, because that's going to be a major question for people. Is that in the FAQ? No, that's got to be a frequent question. Because as we all know,
The most important thing is money.
I haven't figured out how the money flows in this org. But if I was going to rate the page, I still don't feel like I fully grasp what a typical user experience is through Ciba Health. I think the approach is great. From what I've seen, it's different enough. Even though the components of what they're doing have been around for a long time. I don't think people are creating orgs in this way. So I hope this succeeds. I'm going to give it a 6.8 on the page. Definitely a lot of really low-hanging fruit things to update. To add to this page, maybe a few others to explain kind of what it feels like. They have kind of that one image with the person in the middle. But yeah, I think there's a lot more that could be added to this page. It feels like this page is kind of just like early. They still have a lot of stuff to add to it. So we'll check in again at some point. If you want to check them out, Ciba Health, CIBA health.com. As always, brush your teeth, walk in the corner. Check out gotoguild.com if you need to hire me to do customer research for you. Get that feedback in the voice of the customer. Denbo out.